Say hi, Izzy. Say hi. Heading off to Mission Veterinary Specialists to get Izzy's ACL done. Dr. Chow basically recommended them over anybody, and you could only get in to their facility if you're recommended by a veterinary doctor. So I hear they're the best.
They've taken Izzy back to get her weight and stuff, and they're gonna explain like what the surgery is and how everything is gonna go. And I'm a nervous wreck. I mean, I love my dog. She's like my best friend. I just want her to be okay.
People are fairly flat on the top of their, what we call tibial plateau, or on the top of their shin bone. Dogs are not, they're very angled. And it has to do, again, with just kind of looking at this diagram, the way their knees are slightly bent. When people tear their ACL ligament, it's generally a trauma. If dogs do it, usually, almost always, they do it gradually. So they'll tear it little by little. Just a little tear and a little tear, just from running, just from playing, just from walking, just from being a dog. It's just slowly gonna tear that. To counteract this is essentially turn them into the shape of a human knee by making the top of this rather level. So this is the dog walking. If you look at it kind of going to this angle, it's very angled on the top. So when the ACL is being run and jumped, it's sort of stretching it a little, tearing it a little, till one day it tears all the way. And then they have what we call tibial thrust, and that hurts. So what our goal is to fix that instability so they can run, they can jump, they can push off. And to do that, we make that curved cut depicted in the white, we turn it. Now, if you look at this angle, so again, ignore the angle of their leg, look straight at their tibia, it's very flat on top. So now, when you try to run and push off, it doesn't go anywhere. But what about the damage inside of her knee? How much is her ACL torn? And then lastly, how about, are they torn as well? So we get in there, and if we see a problem, we treat that without having to do any big open, what we call arthrotomy. This little instrument that looks like the little tip of a pencil is called a shaver. What it's doing is on the other end of that, there's an open window that's literally removing all of that meniscal tear, all that.
Camera shy, maybe.
Cleaning it up without, again, having to open up her joint. We do this for 5 minutes or half an hour. It really depends on the dog and how much is torn. That's pretty much it. On work before surgery, we always do that. We would do X questions right now. Surgery, we do the x-rays after to make sure it looks good. And then we kind of go from there. So do you have any questions right now?
It's time for surgery, I guess.
Surgery, we do the x-rays after.
We came to visit Izzy, and this is her orange cast right here. She's a little groggy, camera shy maybe, but today, and she's so happy to see you, Izzy. No, you can't get up. You gotta be a good girl.